Welcome to the introduction to the Exceptional Family Member Program and Respite Care. We're glad you could join us today as we talk about the program. We're here to assist you and your family and answer any questions you may have about EFMP. To find out more, call us at 619-524-8031. We encourage you to share and like this video, and don't forget to subscribe to our channel. During our time together, we'll cover the purpose of the program, who is eligible, enrollment, update, disenrollment processes, what are the benefits of enrollment, assignment coordination, family support, common misconceptions, and respite care. The primary purpose of the Marine Corps' EFMP is to ensure continuum of care for eligible Marine Corps family members. This is a Department of Defense program, and enrollment is required for qualifying military families. By following specific procedures and guidelines, EFMP will ensure that Marine sponsors with an exceptional family member, or EFM, are assigned to duty stations where services exist to support the EFM with access and availability to medical and educational services. Additional information about the Marine Corps' EFMP can be found in Marine Corps Order 1754.4. EFMP is comprised of three components: identification and enrollment, assignment coordination, family support. Identification and enrollment. Enrollment in EFMP can come by self-identification, identification during routine health care by a qualified medical provider, identification of a qualifying condition during suitability screening by military medical departments. Now, this is prior to executing orders overseas, a process separate from the EFMP enrollment process, or identification of early intervention services via an individual family service plan or special education or related services through an individualized education program, or IEP. Headquarters Marine Corps EFMP oversees the identification and enrollment process as the responsible authority. Assignment coordination. All continental United States and outside the continental United States orders generated by the Military Occupational Specialty Monitors for EFMP enrolled sponsors are routed to Headquarters Marine Corps EFMP for individual screening. This process occurs through the USMC Manpower Assignment and Support System. The assignment screening process is a function of Headquarters Marine Corps EFMP. Assignment case managers review proposed assignment orders to assess the availability and accessibility to TRICARE Prime authorized medical treatment. The availability of specialty care providers is fluid. Therefore, family support staff should not speculate on the suitability of an assignment or provide a recommendation or confirmation or denial of a particular location's ability to support the family. While CONUS orders are reviewed per the mileage guidelines established in Marine Corps Order 1754.4, Headquarters Marine Corps EFMP will research all authorized medical specialists and subspecialists indicated on the 2792 for availability and accessibility of medical services. Travel distance is calculated from the installation zip code to the TRICARE published address of the provider. Approximate one-way travel limits for appointments are as follows: weekly, 30 miles, monthly, 50 miles, quarterly, 75 miles, biannually, 100 miles, annually, 150 miles. OCONUS orders are limited to the availability of services at the local military treatment facility and within the authorized host nation network. Family support. Installation EFMP staff, under the supervision of the Installation EFMP manager, shall provide family support services to support the continuum of care for the EFM. EFMP staff does not advocate on behalf of Marines and families, but supports and educates individuals as they learn to become effective advocates for themselves and or their family members. Each family are assigned a family caseworker who can assist with enrollment and update process. Conduct a family needs assessment, which involves targeted research, information, resource, and referral. We partner with you as you're advocating and networking within various systems of support. We will assist during PCS moves and when separating from the Marine Corps. We will assist with respite care reimbursement if your family are eligible. We will connect you with our EFMP attorney should you need legal guidance. We can collaborate, support, and attend individualized education program meetings. Should you need special housing considerations based on medical necessity, we will assist you with this process. We offer workshops and networking events for families. Who is eligible? A family member who is enrolled as a dependent in the Marine Corps Total Force System, MCTIFS, and the family member is enrolled as a dependent in the Defense Eligibility Enrollment Reporting System, DEERS, and the family member legally resides with the sponsor. If the sponsor shares custody of the EFM, the sponsor must maintain primary physical custody at least 51%. If the family member has a potentially life-threatening and or chronic medical or physical condition, to include asthma or other respiratory-related diagnoses, with scheduled use of an inhaled inflammatory agent or hospitalizations. If the family member has a current and or chronic diagnosed mental health condition within the last 5 years, to include ADHD, depression, or anxiety that requires treatment by a medical health provider, multiple medications, or education modifications. If your child requires early intervention or has special education eligibility as evidenced by an IFSP or IEP, or if your family member's chronic condition requires adaptive equipment, assistive technology, or environmental or architectural considerations, they are eligible for enrollment. Enrollment, updates, disenrollment. The DD Form 2792 is the family member medical summary. This form and the attached addenda are completed by a qualified medical provider to identify a family member with special needs. A few things to know about the DD Form 2792. Updates are due every 3 years. If there's a change in status prior to the update due date, the Marine must submit an update to capture the current requirement. The addenda are only completed if the provider indicates there has been treatment for asthma, mental health, autism, or a significant developmental delay. Prior to submission to Headquarters EFMP, the family caseworker should ensure the completion of all required documentation, particularly demographics information appears at the top of every page. Medical providers' need and frequency is completed. All necessary pages are signed. DD Form 2792-1. The DD Form 2792-1 is a special education early intervention summary for all school-age children ages 3 to 21 who are being evaluated for or have been found eligible to receive special education or related services. A few things to know about the DD Form 2792-1. The form is completed by the local school district. For EFMs that are homeschooled, the parent or legal guardian is authorized to complete the form. Marines with pending OCONUS orders must submit, if applicable, a current IEP or IFSP to facilitate educational review. This document must be updated every 3 years along with the DD Form 2792. It is essential to understand that in order to disenroll, you must submit a DD Form 2792 and, if applicable, DD Form 2792-1. Disenrollment is not automatic if enrollment is out of date. A family member is disenrolled when a change occurs in one of the following criteria. Medical status. The EFM no longer requires ongoing health care, specialty medical or mental health services as documented by a qualified medical provider on the DD Form 2792. Educational status. The EFM no longer requires early intervention services, special education services, or has graduated from high school as documented on the DD Form 2792 and DD Form 2792-1. Or if the EFM graduated from high school, a copy of the diploma or GED and has no coexisting medical requirements. Dependency status. The EFM is no longer the sponsor's dependent as reflected in DEERS and McTIFs. Reimbursement of enrollment forms. Some TRICARE authorized providers may charge for completion of the DD Form 2792, referencing the TRICARE policy manual, which expressly excludes reimbursement for completion of the form. Absent reimbursement or regulation, authorized provider charges to families are inconsistent and, in some cases, cost prohibitive for families. The Marine Corps believes that families should not bear the cost of form completion to comply with the DoD mandated program and therefore implemented a reimbursement process. The installation EFMP office must receive the following documentation: DD Form 2792, receipt from the provider that includes the following: the physician's name, the date, form completion listed as a separate expense, amount charged, marked paid. You will be reimbursed at the actual cost or a maximum of $15 a page, whichever is less. The maximum reimbursement per package will not exceed $200. You may request reimbursement for one out-of-cycle update within a 12-month period. The reimbursement process can be facilitated by your EFMP family caseworker. Enrollment process. EFM is identified, enrollment forms completed, family brings forms to office, family caseworker reviews the forms and submits to Headquarters EFMP for medical screener review. The medical screener determines eligibility and sends a letter to the service member stating the outcome. The installation assigns a case to a caseworker. Importance of up-to-date enrollment. It is mandatory per Marine Corps Order 1754.4. Outdated paperwork slows order process. Families become ineligible for respite care reimbursement program if any of the EFMs enrolled is out of date. The commander's reports are issued quarterly. The case gets elevated to the Headquarters Marine Corps EFMP. Common misconceptions. Enrollment in the program will allow the service member to choose their duty station. MOS monitors select duty stations prior to EFMP screening based on the Marine Corps mission. Suitability, or overseas screening, is part of EFMP. Suitability screening is not part of EFMP. All service members and their family members are screened prior to going overseas or to remote installations. Enrollment in EFMP will restrict where I can be assigned and hinder my career advancement. Service members enrolled in EFMP receive consideration equal to all others for assignments and promotions. Being enrolled in EFMP means I cannot be deployed. EFMP enrollment does not prevent a service member from being deployed. Service members enrolled in EFMP are always eligible for deployment for any length of time. Being enrolled means I cannot get stationed overseas. EFMP enrollment does not prohibit overseas assignments. The assignment will be to a pinpoint location that has been coordinated with the medical activity and the DoD school system when special education or early intervention services are required. How does EFMP ensure confidentiality? Local EFMP managers Provide limited information to the unit commander or his or her designee to ensure commands are aware of those Marines who need to complete an update to maintain compliance. The information shared with command is limited to the name and grade of sponsor, date of enrollment, and date of next triennial update. The specific medical diagnosis and treatment and/or special education needs of the family member will not be shared with command unless the sponsor or the adult EFM family member provides written permission to do so. The EFMP case management system will not become an element of the manpower management system, individual record books, or the parent command records of the sponsor, nor be referenced in performance appraisals such as fitness reports. This concludes the introduction to the Exceptional Family Member Program. We will share with you the respite care information in a few moments. Welcome back. We'll now discuss the Marine Corps' Respite Care Program. Respite Care Background. The EFMP initiated the Respite Care Reimbursement Program in 2008 to support the impact of a high operational tempo on families who support a family member with exceptional needs. Intended use. Let's explore the intended use of the Respite Care Reimbursement Program. Respite is used to reduce stress on sponsor families by providing temporary rest periods for family members who care for those with special needs. Families are eligible up to 20 hours of respite care per month per family. Respite is authorized to be used for going on a date night, having lunch with a friend, getting a haircut, taking a nap, going to the gym. It is not authorized as supplemental income for preschool, therapy or therapeutic recreational sessions for the EFM, during hospitalization of the EFM, for the spouse or sponsors to attend work or school. Respite care eligibility. EFMP respite care reimbursement is available for EFMs identified as a level of need 3 or 4. Level of need 3. Level of need 3 includes EFMP families with children 18 years or younger with severe special needs that require trained support from qualified providers to maintain the health and safety of the EFM. Providers for an EFM identified as a level of need 3 should have a valid certification through a state or national agency. Appropriate certified providers will vary depending on the needs of the EFM. Examples include CNA, a mental health tech, BCABA, etc. Level of need 4. Level of need 4 includes EFMP family members of all ages, including adults, with profound special needs that require skilled care services as documented by qualified providers to maintain the health and safety of the EFM. Providers for an EFM identified as a level of need 4 should have a valid professional license. Appropriate licensed providers will vary depending on the needs of the EFM. Examples include RN, LCSW, BCBA, special education teacher, etc. Who determines the level of need? Level of need is determined by Headquarters EFMP nurse case managers during the enrollment or update eligibility review using a quantitative rubric based on the documentation submitted to EFMP. That would be the 2792, 2792-1, and IEP, for example. How is level of need determined? Using an evidence-based determination process, medical screeners review submitted documents to determine the level of need. Can my level of need change? As an EFM's requirements change, the level of need may also change to reflect the current functioning and status. Selecting providers. Families select a provider for local respite. Sponsors must provide appropriate documentation of respite care provider skill for levels of need 3 and 4 EFMs, example, CNA, RN, special education teacher. Requirements for reimbursement. The EFM legally resides full-time with the sponsor. There are exceptions. All EFMs enrolled must be current. Any funds expended by the family while ineligible will not be reimbursed. The sponsor must provide appropriate documentation of the respite care provider's skill. The EFMP office, where the family resides, is authorized to reimburse respite care expenses when authorized separation occurs. The sponsor must sign all reimbursement logs verifying the accuracy of the information. Families who use providers who do not provide enough proof of skill requirements are compensated at a lower level for one reporting period, 30 days, and are no longer eligible for the respite program after receiving written notification from the installation EFMP manager. Reimbursement will be reinstated after proper documentation is submitted. So, what are the reimbursement rates of care? For a level of need 3 family, one EFM will not exceed hourly base CDC rates times 3. 2 or more EFMs not to exceed hourly base CDC rate times 5. For a level of need 4 EFMs, under no circumstances will care exceed $45 per hour. 2 or more EFMs, under no circumstances will care exceed $60 per hour. Your EFMP caseworker will provide all forms required for this program. The initial documents are the ACH, Statement of Understanding, and verification of eligibility. Each month, families submit SF 1164 and the reimbursement log to their family caseworkers. Please note that your EFMP caseworker will walk you through the entire respite process. They are here to come alongside you and to make sure that these systems are working for you, these programs are working for you. So don't hesitate to reach out to them as you're completing these forms and, again, seeking assistance with ideas for possible providers. Every EFMP family has a unique set of circumstances, and there are times when a policy exception is necessary. An exception to policy may be requested by the sponsor and routed through the sponsor's chain of command for appropriate command endorsements. Exception to policy may be requested for use of a non-certified, unlicensed provider, increase in authorized hours or pay. Proof of provider experience and skill to care for the EFM must be documented in an AA form for consideration in lieu of certification or licensure. The exception to policy will be reviewed by DC, M&RA. This is the conclusion of our workshop. We appreciate your attendance. If you have any additional questions concerning EFMP or any of the provided information, please contact us at 619-524-8031, and we will be happy to assist you. Don't forget to follow, like, and subscribe to our channel, and we look forward to interacting with you on our social media platforms.